Think prevention, live long.
This is Dr. Shah. I'm sitting down with Mr. Blomer here, Robert Blomer. Tell me, how long I know you, Mr. Blomer, now?
Oh my God, 20?
20 years?
At least.
And tell me what have your heart have gone through in terms of, you had open heart?
Yes, and 81.
81, so that's
And I'm
almost...
still surviving.
And you've done very well. You exercise regularly.
I try.
Try. And tell me about this recently, what you went through with cholesterol medicine issue. Tell me about it. What are your thoughts? And where do you get your prescription from?
Oh gosh. I get some from the VA. I try to get the most expensive ones from the VA. Anyhow, they're telling me I can't have Zetia because it's too expensive otherwise.
So,
I feel that it's the doctor's place to tell me what to take, not the insurance company or VA or any other. That's how I feel.
Yeah, no, I think I agree.
Their job, that's your job.
Right, and I agree with you. And I think obviously right now everybody's concerned about cost and what's the best way to take care of people. And I think, to me, doctors, the insurance companies, the government, the people, we all need to work together, obviously. But I think I agree with you. Your point is that eventually it's between doctor and the patient. And I think, to me,
and it ain't that way.
It's not that way anymore. And I agree with you. I think eventually it's going to come down between patient and the doctor. What do you call an expense? I think, to me, it's an expense to go to hospital and have a heart attack. To me, it's not an expense to take the right medicine and prevent a heart attack. So I think we will talk to whatever people need to be. But if you need the Zetia and you have to have it, we'll try without the Zetia first as a diet. Okay. But there's a small chance you will need Zetia. Then I'll just knock on the VA door and say, you need Zetia. And if necessary, we'll go in a higher level. And that's the key thing. I think eventually deciding what the patient needs. Because what he has done for the last 30 years in terms of not having another major heart issue is partly because of him and his exercise program, and partly because of the medications he's fortunate to have. And I think if you take those things away, eventually system will be spending a lot more money by you going to the hospital than just providing you the proper medicine. And that's, I think, what's missing in this economy right now, that we're not trying to do a proactive, preventative role. We're just trying to say, let's cancel the medication, but they don't realize that in 2-3 years, you may end up having more blockage. And that's when I think they're going to end up spending more money. And we're going to look into this thing. So, thanks.
Okay. One more thing.
One more thing.
They're telling her what she's taking a prescription right now. It's supposed to cost $800 for a prescription. $800.
This is Mrs. Blomer here. See their patient for 15 years also, and kind of good dear friend here. And I'm kind of torn today because I saw her after a few months, and she just told me that she has had a cancer for ovarian surgery, and now she's on chemotherapy. So it's kind of a concern for all of us, but I know she's going to prevail. She's been tough for last many years, and I know her that she can handle anything which is thrown at her. But main thing we're talking today about is this cost of medicine, like Mr. Blomer is saying. And as I understood just now, that you're saying that one of that medicine is $800 a month.
Okay, but it only cost me $34. Okay, and then the second prescription was $7.
Yes.
Now the prescription, they called and said, that's it, there ain't no more. She can't have any more. How'd they word that?
I'm seeing Dr. Minier.
Explain me what happened on that.
They sent me a letter and said that they won't refill this prescription any longer. It's an anti-nausea medication that I really need after chemotherapy. And I have to get with Dr. Minier, and he's got to fill out some papers in order for me to get another prescription.
Yeah, I think obviously we all have to go through the process of making sure the medicine is necessary, is not overutilized, and there's not necessary money spent. But I think eventually it's going to come down to what you need, and what Dr. Minier decides is what you should get. And I wish somehow there's a way of cutting the time in between so you can take your chemo without getting this nauseous feeling. And I think sometimes the paperwork leads to so many days while the secretaries and nurses don't realize that while they're filling out the paperwork, it's you who is nauseous, not them. You know what I'm saying?
Yes, I do.
When the secretary and nurse and the insurance company and the pharmacy, when they are filling out these papers and it takes them 1 week to get all this thing approved, they are not nauseous for 1 week. It's you who is nauseous for 1 week. And I wish they understand that. And can we change it overnight? No. But I think people need to be just more cognizant about what a patient feels, not what a paper says. So we're going to change it.
I hope so.
I think it needs to be done.
Yeah, but they paid for it 2 times, and all of a sudden you just shut it off. Now,
Yeah, I think it's.
right.
I think
To
it's.
me, it ain't right.
Yeah, I think it's part of it's just the bureaucracy. I think it's just a paperwork issue. But I think my main emphasis is that people forget that if they paid it for 2 times, and if the 3rd time, if it's not covered, don't forget the patient is still having nausea. Don't say that, okay, 2 times, so she's done with. No. If you cannot pay for it, at least remember that she still has a nausea and see what more can be done. If this is not covered, what is the alternative? If this is the perfect medicine, can we at least give her for a week until we get the paperwork done? I think to me, remembering the patient, not the paper, is the most important part which we are forgetting in this country. And we're gonna change it, whatever it takes.
I hope so. It needs it.
When we think prevention, live long, the heart of mid-Michigan strong.